I am going to say something controversial, and I hope that this video finds the right people. But as a doctor who sees mainly women who have facial hair or PCOS, one of the things that I truly believe that is going on with these women is the fact that they are not doing the type of work that works for their body. And I will go so far as to say that if you have any form of disease in your body as a woman, then there is something that you are doing that is not working for your body. Women tend to have a lot of work placed on them, responsibility placed on them, and society is partially responsible for this, right? You need to take care of your siblings, you need to work a 9 to 5, you need to do all of these things, right? You go into a marriage, and then the burden of the work falls on you, right? And so a lot of women are taught to take in a lot of this work, to carry this burden that isn't their burden to carry. And so if you're doing work, or if you're putting stress on yourself that is beyond what your body is capable of, that is going to raise your cortisol levels. And if your cortisol levels are up chronically, that is going to lead to disease. For some people, it's going to lead to high testosterone and they're going to get facial hair. For some people, it's going to lead to activation of autoimmune diseases. For some people, it's going to lead to cancer. It doesn't matter. It could lead to mental health issues. But the bottom line is all of these disease is because people are not at ease. Their lives are not at ease. And you have to then ask yourself the question, if you're a woman, you were born a woman, and you're developing facial hair, you're developing male characteristics, then maybe you're doing the work that a man is supposed to be doing. Because if you were at ease, you wouldn't have disease, right? And so a lot of women, and I'm talking to women because this is who I primarily see in the office, need to truly tap into ease in their life. You need to start setting boundaries. You need to work less or work on things that bring you joy and purpose and fulfillment, and not work on things that bring you stress. Because if you're working and feeding something that gives you stress, then you're making it grow. And if you make the stress grow, you're going to get sicker. It could be mentally, it could be physically, it could be spiritually, it could be financially. It doesn't matter. Whatever you put energy into, if it's not working for you, it's going to manifest in your body as disease. And so if women are doing things that they're not supposed to be doing and developing male characteristics, now we're seeing men are developing female characteristics. You have 21-year-olds who have low testosterone because they're not being challenged to their level, to their capability, right? So the roles have become reversed. We're handling all of the stress, all of the things are being put on us, and part of that is society, right? Society is making it seem like women are supposed to work, and on top of that, women are supposed to work alone. It's discouraging community, it's discouraging the thing that women are supposed to do, which is work in their purpose and work as a group. So if you have something like PCOS or facial hair, you have to ask yourself, what are you doing that is not serving you? Because that is a manifestation of what's happening on the inside, right? I have this conversation every single day with my patients. If you're a woman and your testosterone or your androgens are high, it's because your stress levels are high most of the time, right? And if this is something that has been going on for generations, then this generational stress that is continuing to be perpetuated, and somebody needs to stop it, right? Because nobody is supposed to have disease. Like, I'm going to keep saying this. Disease, dis-ease. We're not at ease, which is why we're sick. So you need to pursue ease. You need to pursue working in your purpose. And I'm sure somebody in the comments is going to say, oh, I need to live, blah, blah, blah. I get that. But you can work in a job or in a situation that is not the best, but work towards something that is going to bring you ease. Because as a woman, if you're not at ease, you're going to have disease, and it's usually not fun. It's usually autoimmune disorders, it's usually cancer, it's facial hair, it's infertility. Infertility is a huge issue because our womanhood is operating or functioning in a male world. We're doing male work. And so then it's not compatible with our female reproductive system. And then now we're having issues having children. Again, like I said, this is probably going to be controversial, but this is something that I have been thinking about significantly because I see the same thing over and over and over again. Women are not taking care of themselves. Women are giving their power away to people. And then the result is all of these diseases. It's weight gain, it's autoimmune disorders, it's breast cancer, it's mental health issues that shouldn't be activated if your life was at ease, if you were living in a more joyful state, right? And the reverse is true. Men are struggling because they have been raised in a way where it's not compatible with them, and so they're having their struggles. But that's not who I'm trying to talk to. I'm trying to talk to women, and I'm trying to let women know that if you're not working on your purpose, if you're not striving for ease in your life, which requires you to do the things that are going to be beneficial for you and your community, which is typically women, you're going to have disease. And that, in my opinion, is the fact. So we need to truly evaluate our lives and ask ourselves, are we living in our purpose? Is there ease in your life? And once you pursue that and you go in that direction, I promise you, we're going to be able to manage all the diseases that we're dealing with.